Hello, welcome to this week's episode of Ask Dr. Dan. This week we are going to be talking about bioidentical hormone replacement therapy. As we age, our hormone levels naturally decline, including our testosterone, our estrogen, and progesterone. As these levels decline, we begin to feel this decline with symptoms such as decreased energy, decreased libido, irritability, hot flashes, night sweats, decreased muscle mass, increased fat, and many other symptoms. Also, this can cause things like increased glucose, our blood sugars, as well as increasing our cholesterol. At Apex Center for Regenerative Medicine, we use bioidentical hormone pellets, which are inserted under the skin and give a steady state of hormone for women for about 3 to 4 months and for men for about 4 to 6 months. So any questions about bioidentical hormone replacement therapy? We will be taking your questions over the course of the week, and I will be answering your questions on Friday. Have a great week, and remember, don't operate, regenerate.